would like to ask your permission to use this video for
Yes.
educational purposes and on internet. Now, this is a follow-up testimonials. We are about 8 months out of a complex thoracic fusion.
Yes.
I say complex thoracic fusion and because as you told us before, without telling the name of the place, that you have been told that surgery cannot be done for you.
Right.
Tell me about it. What was going on?
Well, I was having the radiating pain around. It was interfering with my breathing. There wasn't anything that would stop it.
1 to
And
10, how bad was that pain?
It could get up to an 8 or 9.
Mm-hmm.
And just miserable trying to get comfortable, and nothing would help.
Mm-hmm.
And I couldn't believe that there wasn't anything they could do.
But professional people, spine surgeon, told you nothing can be done for
No,
that.
they said they reserved that for just trauma patients.
Because? Did they explain to you why?
No.
And the reason for that is, for a surgery like that, you have to literally crack open your chest,
Yep.
collapse your lung, take care of the problem, then put a chest tube in you, put you in the ICU, and this is a massive surgery.
Yep.
And it makes sense that we reserve that for when you're about to die. You have a trauma, you're about to die, you're getting paralyzed.
Sure.
So then risk versus benefit is justified.
Yeah.
But you weren't going, at least not immediately going to die of that, just having this pain. So the risk versus benefit in that surgery that my colleague had to offer you wasn't justified. But was that livable?
No, it wasn't.
Yeah.
And I was still young enough that I was facing many, many years
Mm-hmm.
of what, no relief.
Mm-hmm.
And I just couldn't accept that.
Yeah. Now, I'm going to just turn around what we did, because we did the surgery and we didn't crack open your chest. We didn't put you in the ICU. As a matter of fact, this is the record of the surgery. We did that surgery in 91 minutes. We lost 99 cc of blood, and you stayed just 2 nights in the hospital, and you didn't stay in the ICU actually.
No.
And this is what we did. We did the 3-level thoracic fusion. And here are the screws that we see here going up and down, exactly located where they are supposed to be. And where we did the surgery, actually, we are able to see that the bone actually is beautifully growing. So, and we did all that surgery in about 1.5 hours. When did the part of the pain that turning around the chest, when did that go away?
I didn't feel it after surgery. I just felt,
Back pain,
surgical.
surgical pain.
Yeah.
So
but
you
none of
woke
that
up and that was
radiation.
gone?
Yes.
Okay. And has that state gone, that
Yes.
pain? Okay, regarding the chest, how is your daily activity? How has it been?
Well, I'm active. I mow. I have to be careful.
Yes.
Because like I said, if I overstress, then I'm stiff. But
Mhm.
it's not pain. It's just
Mhm.
stiffness.
Yeah.
So, I can live with that.
Yeah. So far surgery has been successful to eliminate
Absolutely.
that problem. And how long did you live before the surgery with that pain?
Probably about 8-9 years.
8-9 years.
Yeah.
How much were you limited? Let's say before all of this start, you were at 100%. At what percentage of living were you operating in the last few years before the surgery? Half?
Yeah,
1/3?
at least.
Yeah.
I knew if I tried to do anything, I was going to pay the price.
Mhm.
And with no relief and no
Yeah.
way to stop it.
Yeah. Now, what do you think where you are now? That
I'm fantastic.
now, are you back where you want to be, 100% of what you're expecting, or are you still, at 90%, or
I would say
realistically,
90%.
90%.
I still get
That's
stiff.
realistic.
But I know
Yeah.
the exercises. I know what to do. So
And how long did it take you to get to that 90% or 80% after the surgery? How many weeks or months did it take you to be able to do basic things?
I would
And
say
then-
3 months.
Yeah, okay.
3
3 months to
months.
do full activity, or?
Well, we're into summer now,
Yeah.
and I'm a lot more active
Yeah,
than I was in the winter time. So, yeah, I think about it before I do some things
Good.
because I don't want to ruin
That
things.
is very smart.
But I know I don't have that pain that comes
Good.
around, so
Yeah.
I tend to forget
Yeah.
what that was like.
Well, and that is a good thing that you forget that pain. We don't want you to remember that
No,
pain.
I don't want to.
Thank you very much for the interview. Any other
Sure.
comment or any other question you may want to have?
No, I mean, it has been life saving for me because I just couldn't face
Mhm.
going into. Well, I refuse to be elderly, but I mean, because things kind of just get worse, and,
Yes, yes.
and I had no hope.
Yeah.
But now, I mean, I
In-
can do.
I think what you're very active, and that's a good thing.
Yep.
Our body is made to move. If you are not active, if you don't move, we decondition, and that happens extremely fast. We know that in your age group, if you quit walking, your heart deconditions so fast. People when we get to at that level of that age, if they quit walking for whatever reason, their prognosis is worse than being diagnosed with cancer.
Yes.
Because our body and lung heart shut down, and then maybe we don't maybe we can't even live with the pain if we don't do anything, but our prognosis is so much worse because our heart and lung decondition, and most of people then have a heart attack or pulmonary problem, blood clot in the leg, shooting down. The prognosis, this is not ambulating, is a deadly disease in the elderly patient. And with elderly, we say 75. So how old are you?
I'm 66.
So you're not there yet.
No.
Okay, so but if you quit walking in your age group, you start deconditioning much faster, and that is a deadly disease. So in a sense, that's a critique to my colleague and myself, that if we say go live with the pain because surgery is too dangerous, most of the people don't go live with that. They go and they die much sooner.
Well, and depression. When you're given a hopeless diagnosis with no help, I mean, depression moves right along with deconditioning and everything else.
Absolutely, they go hand in hand. And unfortunately, that your story is not unique. I wish you would be one of handful people going through that. This is a daily occurrence in the United States. Well, and I'm hoping this testimonial help for people to know what their options.
There's hope.
Yes. Thank you so much. I
Sure.
appreciate that.